There are two different guidelines, and to confuse it, they're both 1 through 4. So you have 1 through 4 here and 1 through 4 there. And the first 1 through 4 is put out by the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists. So it's a joint guideline, and it goes through what levels of facilities that a baby needs. And level 1 is our well-born baby who is going to go home within a day or two and is going to get all the routine screenings and is hopefully going to feed well and grow well and do wonderfully. And that's a well-baby nursery. And then we've got level 2, and these are the babies who need just a little bit more for maybe a few hours, maybe a day or two, but they don't really need all of the whistles. And they're going to do pretty well within a day or two again. And then we've got level 3, which is our neonatal intensive care unit, and then level 4, which are these super special NICUs that are usually in big centers that have 24 hours, 24/7 coverage with a neonatologist in-house. They have access to subspecialties. They have access to very invasive but also life-saving therapies like ECMO, where it's basically putting the baby on heart bypass for a while. So the levels 1 through 4 kind of tell you where the baby needs to go, but it doesn't tell you what the baby needs on a day-to-day basis. And when you're actually practicing in the neonatal intensive care unit, you need to decide, well, what did that baby need today? Do they need, and then so now we have a whole nother level 1 through 4. And so we have level 1, which is a stable baby, level 2, which is a baby that needs a little bit of nursing and a little bit of care, maybe some oxygen, maybe a little bit of help feeding. Level 3, which is, again, another step up, and then level 4 babies who are very sick and needed intensive care. They're on a ventilator or they're on ECMO. Now you may be in a level 4 facility because you need heart surgery, for example, but that day you're actually doing pretty good and you only required level 2 care or level 3 care. So that's the dichotomy, and we do have a terrific table that walks clinicians through where they can see, okay, this baby needed an umbilical catheter, that's going to be a level 4. Or this baby needed to be on the vent, but they only needed it for less than 5 minutes. While they were born, they had a little bit of respiratory distress, they needed to be suctioned, and that whole process, they got on the vent, but they were quickly taken off. Okay, so there we go, that's a level 3. And so it kind of goes through all these scenarios where people can look at it and say, okay, I can figure out where my baby needs to be that day.